Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Hello, my name's Tarsam Chand. I'm 60 years old. I've lived most of my life in this country, in Leicester. I've been educated here and done an apprenticeship in electrical engineering, and ever since I was working as a electrical maintenance engineer for a company that manufactures cans for soft drinks. And up to the point of being diagnosed, I led a very active life, and due to the working arrangements, I was going to the gym about 4 times a week, and I was really a very fit and healthy person. And the last thing was on my mind that I might be suffering from a cancer. It was quite a bit of a shock to the system to when I was actually diagnosed that someone who had been healthy all their life to actually come down with such a disease. If it had been sort of slow progressive, then you could understand that there's something there, but to be actually just diagnosed with cancer was very devastating, and it affected him very in a psychological way as well. It did.
Tarsam, thanks for coming in today and sharing your story with us. I'm interested to know, first of all, how were you first diagnosed? What were the early signs, and how did it come to attention?
Right, the early sign was in 2006. As I actually sort of used to go to the gym, I could feel tingling sensations in my back, and I didn't take too much notice of it. And towards the middle of 2006, I actually experienced some pain in my ribs, especially on the right hand side, and the pain wasn't sort of consistent. The pain was only a bit sharper when I actually bent down to pick something or some movement related. Mm-hmm. And also when I was in bed and turned over, the pain got sharper. Mm-hmm. And then it sort of died down. So I didn't take too much notice of it, and I did actually approach my GP, and then he said, because I actually go to the gym quite regularly. It could be muscular strain, and I was given a course of some painkillers. But when I looked, it was diclofenac. But when I looked at the side effects of diclofenac, I hesitated to take any. And then so I just tolerated the pain. And then one day, just all the pains from the right-hand side went over to my left-hand side. So I went to my surgery, and they still said, Karen, take the painkillers and it might go away. But I wasn't really sort of very happy with that. So I went to the A&E and explained the pains on my left-hand side, and they quickly took me in and just wired me up for everything, all the tests and everything. Mm-hmm. So I had an ECG done, a X-rays done, blood sugar levels done, everything that you can name, all the tests they done. And within about an hour and a half to 2 hours, they discharged me and said that, Mr. Chand, you're a very fit and healthy person. Okay. And we can't see what's wrong with you. Yes. And then I went away quite happy, really, as though they can't find anything wrong with it, but the actual pains were still there. And then about a week after the visit to the hospital, I got a phone call from a secretary of Dr. Voltman, and this was actually from Glenfield Hospital, and he says, we need you to come in, and Dr. Voltman wants to see you. So I got worried again, and then he says, we need to check. Dr. Voltman's had a look at your X-rays, and he saw some sort of dark patches. Mm. So
these are the X-rays you had taken at A&E?
Yes, right. Yeah, these were the ones that which they said nothing wrong with me.
Yes.
And then I got a bit concerned again, but actually sort of went along to give some blood so they could do their tests. And then at the end of after the test, it says what they were looking for was TB, which turned out to be negative. So I built quite a bit of a rapport with Dr. Voltman, and they said the pains are still there, so they were looking from a respiratory point of view. So they actually done a CT scans, and all they could do, and then they said that after all these exhaustive tests and scans, they said, Mr. Chand, we know what's not wrong with you, but we still don't know any wiser. And then I kept going on a monthly basis to see Dr. Voltman at his clinics, and with the hope that they might find something. And then one day I was there, it'll be about June time in 2006, and he had I remember it quite well, it was actually at the General Hospital, and I remember it quite well, and he had a junior doctor with him, and he normally asked for the consent if it's okay. I said, yeah, fine, no problem. And so they said to me, we can't really find anything wrong with you, we've done everything what we could. And then the junior doctor said that maybe we should actually test for this Benz-Jones protein. Mm. To me, I don't know what that was.
So that's a special protein in the urine, which is a marker of a myeloma, isn't it?
That's right, yeah, that's what I came to find out afterwards.
Yes.
And then after that session, they gave me, they took a blood sample and a urine sample, and they said to come back in about 2 weeks' time, and then we'll have some results. And then when I went back, it says, I'm sorry to say, Mr. Chand, but we have found out what's wrong with you, but you've got myeloma. Mm. So, and we've gone as far as we can, and then we need to hand you over to the hematologist at the Royal Infirmary. So I did thank him for perseverance.
Had you heard of myeloma?
I had not heard of myeloma. prior to being diagnosed.
And it just shows you with quite a rare condition, it can be difficult to get the diagnosis initially.
Yes, yeah, this is one of the problems, and you're losing time. You can have it, but you're losing time all the time till it gets diagnosed. And when I actually was the haematologist at the Royal Infirmary, they had to reconfirm the diagnosis, which took about another 3 months through appointments and everything. And then by the time they actually found out the paraprotein level was 37, I think, milligrams per litre, whatever they go. And even though it was still early stages, but it needed intervention and treatment straight away, it did. And then to determine what damage has been done to my bones, I had actually had a x-rays, and then also about November time, towards the end of November 2006, there was actually a two sessions, but one was a full skeletal survey followed by an MRI scan. And I went to the skeletal survey, they said nothing, but then went to the MRI scan, and then they kept me waiting after a while. Says, we just need to have a word with the doctor. And then that's when I found out that how serious the damage had been done by the myeloma. They told me I've got damage on the vertebrae, so it's T1, etc. And they said one of your vertebrae is collapsed, so it's actually pressing on your cord, so we need to keep you in. You're not going home, anything like that. So I was kept in their observation, and then they were very concerned about in case the vertebrae moved and caused any damage on the cord. And that took about a week. They were doing all their tests and everything, but then I said that it's not causing me a problem. I'm only feeling tingling, so it sort of convinced them to start the treatment rather than look at the vertebrae problem. So they started me on steroids that evening, and I really sort of didn't even have time to sort of take it all in, really. Everything was all sort of quite rushed, and when I actually did have time to take it in, and the thinking about the cancer, and the whole world around me had collapsed, because reflecting on my life as a healthy person throughout, and the number of times I've been on the sick, you can count on one hand throughout my working career, because I enjoy my job and I look forward to going to work, and but to be told you've got cancer, and then the life expectancy I was given was only 2 to 3 years.
Really? Yeah.
So that was devastating, and I really didn't know what it hit me and how to cope with it. And I was really, really sort of very, very worried about, because of my family I've got a wife, got 3 children, two boys, and the youngest is a daughter, and they hadn't been settled in their own careers yet, and then they're still at university, and all sorts of things were going through my head, so if I'd known I've got cancer, I could actually sort of got them settled and prepared them. But everything, and the thought of actually only living for about 2-3 years was also very, very daunting. And I although I never had depression, I don't know what depression was at that time, but I tended to shut myself off from the whole world. And because it had been the winter months, and as soon as it got dark, I wanted to be home. You know, I didn't want to talk to anybody outside of my immediate family, which is my wife and 3 children. And just thinking, what will people think? He's got cancer. And the way to that big sea, it's phenomenal. You know, it is. And it took me quite a while to actually sort of to come to terms with it. It did.
You told us there about the initial diagnosis, which was quite protracted. You know, you fought, if you like, to get that diagnosis, and you eventually found out you had that myeloma. And myeloma is one of the less common cancers, you know, about 3% or so of all of the malignancies. What's it like initially? You described it, but in emotional terms, to be diagnosed with cancer, would you say?
Well, even at the thought of death, I used to sort of break down in tears, you know, and you know, it was very, very emotionally, very, very difficult, and there was no support available at that time. I was given a diagnosis, and that's it, and they focused on the treatment. So what I actually used to do was, when I used to go to the clinics, or the myeloma clinics, I used to talk to people around me to get an idea of where I fitted.
Yes.
Some were worse off than me, some were better off than me. Some didn't want to talk about it. So, but a lot of them actually wanted to talk about it, and then it made them feel better. So I used to always make a point of trying to talk to someone.
So you sought out the contact from other peers, other patients.
Yes, that's right.
And generally you found that quite useful.
Yes, I found that quite useful, and then I started looking on the internet about myeloma, things like that. Then I found Myeloma UK website was very, very informative.
So what did you find out about myeloma? What can you tell the viewers in essence?
Well, myeloma is a disease of the bones, and it is the plasma cells which go wrong, and these cells, or the white cells, and they usually are the only sort of reproduce to actually create an antibody when you have an infection, and then after they've done their job, they're supposed to die away, but possibly some of them don't die and stay dormant, and they actually sort of come back, come back again, and in a form of cancer, and they crowd out the good cells, and also they destroy the bone from the inside at a higher rate than the repair mechanism. So that's the sort of things I found out, and I couldn't actually find out what the cause of myeloma was. It was very sort of broad. It was actually either radiation, exposed to radiation, or chemicals, or some sort of a viruses or anything like that.
I mean, essentially, people don't know. They don't know the cause.
No.
Like most cancers, the cause not really known, other than associations with certain factors in the environment, like you said.
Yeah. In my work experience, there was a radioactive sources at the workplace.
You worried that might have contributed?
That might have got, and there was sort of chemicals, but like I say, if it can't be pointed down to any particular the cause of it, then it's just guesswork, really.
Now, what people might not know about myeloma, one of the things is that it tends to spread beyond the bones in many cases. In other words, it can become a systemic disease, which means different organs, different parts of the body can be affected, usually by a buildup of abnormal protein, such as amyloid. And have you met people or had any tests yourself which have indicated that has happened at all?
the tests that I've not met any people when I got first diagnosed with the other organ damage.
Yeah.
And the tests they were doing for me was that they could actually, because the myeloma, it excretes the calcium into the bloodstream, the excess calcium, which could damage your kidneys and things like that. So I've always been tested for the other organs functions and like the kidney function and things like that. And in my case, there was no other damage apart from just the vertebrae.
So let's come on now to what treatment you had for the myeloma, because I understand basically you had two phases really. You had the illness in 2006, which was fully treated and went into remission. But you did have a stem cell transplant then, didn't you? And then you've had a more recent recurrence of illness and treated again with a second stem cell transplant. So what have you been through in treatment terms so far?
On the first time when I was diagnosed, the treatment was actually called VAD, and it was actually in a form where there was dexamethasone, and also there was actually two solutions that you actually used to have a pump. I had a Hickman line put in here, and this pump would actually pump the chemotherapy into the line, and also take a course of the in a course of dexamethasone as well. This was actually sort of like a once every for a week, once a month. So after a course of that, the cancer the paraprotein hadn't come down. Well, it had come down, but at the same time, what they actually done was give me some radiotherapy on the vertebrae that was affected. So we couldn't tell whether it was the radiotherapy that actually brought the paraprotein down. It come down from about 37 to about 19. Or was it the actual chemotherapy? So it was conflicting. So then it stayed around 19. So I think it was actually they concluded that it was the radiotherapy that was up to the area that brought the paraprotein down. And then had a break. Then I went on to thalidomide-based chemotherapy, which was actually CTD, which was dexamethasone, and there was also thalidomide, and the other one I can't remember now, but there was 3 drugs anyway, but they're all in tablet form. And this was an 18-week cycle, and that brought the paraprotein right down to about 2.1 progressively, so that was working. And then after that, the progress was to do a harvest stem cells. So once the chemotherapy was out of my system, then they actually done this stem cell harvesting, which they harvested enough for two stem cell operations. So by this time, in 2006, this was coming on to about a year on. So it was about November 2007 that I actually was given this stem cell transplant. But at the same time, followed by about 3-month gap, one of my fellow colleagues that I met at the Royal Infirmary, who I used to work with, a previous workplace, and he had got myeloma, and he was actually going through the same treatment as I'd actually gone through, and I was actually acting as a support for him at what to expect at each stage. And
so that was quite useful, because you not just got that contact from other patients who you got information from. You had a role as a source of information and help and support too.
That's right. And I felt that I actually had to do that to support people, because when when I got diagnosed, I used to talk to the other patients next to me, and an amazing thing happened is that I actually came across an Asian gentleman, and he was about similar age, perhaps a few years older than me, and I spoke to him, and he says, I said, you know, have you got myeloma as well then? He says, yeah, I was diagnosed 10 years ago. So that gave me a lot of hope.
Yes.
It did. And then I met him, that gave me hope. Then I met him again on another clinic session, and he said to me, he says, what are you worried about? I've lived 10 years. And then, just like that, my depression, the whole attitude towards cancer changed. And I've never met the gentleman again. And I actually sort of opened up to my workmates because they were anxious to know what was happening to me. And then through meeting this person, I actually managed to start accepting it and living with it and then moving on.
So it sounds like there were two phases really. One where you were burdened by the idea that your life was very limited. You had been told that the outlook, the prognosis might be just a few years.
That's right, yeah.
But then you had it from a real person who, you know, had myeloma too.
That's right.
Their outlook was actually very good.
That's right.
And you began to believe that yourself.
Yeah, that's right, yeah. And then I managed to sort of talk to people, opened up, share my experiences, and it's everything is actually in the mind. You can actually sort of make it as big as you want or little as you want, and then once you actually start talking to other people around you, you find you'll be surprised how supportive they are, whereas you think in the opposite way around. There's more supportive people than people with negative views towards you.
I'm interested to talk about what help and support is around in general. Just in general terms, before we go into specifics, do you think that more help should be around than is currently around, if you know what I mean, at least in the system that you've seen?
I believe that there should be more help from the around than it is now. When you get diagnosed with cancer, there's a twofold effect on the person. One is you got your cancer, then the hematologists are going to deal with that problem. But then the other side of it is a psychological side of it. Is how do you cope with it, and that is the support which is most lacking. And if the two went hand in hand, whereas you got referred to a psychologist, so they can help you cope psychologically with the disease, you stand a better chance of not being sort of going to a state of depression and things like that. You know? And it's all about how you take it psychologically, and your outlook on the cancer. If it's a negative, you could actually affect your treatment. But if you have a positive approach, then things would work out better.
But there are times when it's very hard to maintain that, isn't it?
It is.
When the mood can be low, or you're very on edge or anxious. Is there any answer? Is there any advice you can give for people who are struggling right now?
What advice I would give is that the route I've gone through is to look at if there's any support groups in your area, and there were no support groups at the time when I was actually diagnosed, but we did set up a myeloma support group about 4 years ago, because the number of people being diagnosed with myeloma was increasing.
Yep.
So with the Macmillan nurse at the Royal Infirmary, along with the group, they decided to set up a support group, which it helped a lot. You can actually go along, talk to, share your experiences, and the chances are the symptoms and experiences are all going to be the same with each other, and it'd be very comforting as well.
There's certain similarities between people, maybe more similarities than differences. So when you went to the group and it got going, what was your impression of how much it helped people who were attending?
Well, I actually, because I've actually gone through all the emotions and everything, and I actually became like a leading example of gone through the tunnel and come out the other end, and they looked to me as a beacon, as that we can get there as well, you know. You know, and it was very helpful, the ones that had been newly diagnosed with myeloma. So rather than, it helped me because I was helping them. You know, so that's the thing I like about it. Is that
okay, so I'm getting the picture there that you went through that big episode in the beginning in 2006, and you went into remission, didn't you? Where do things stand for you now?
Right, I've had remission for about 4 years, and then back in 2012, my paraprotein started coming back, and before it was actually no trace. Then gradually, over a year, it got to about 27. It did, and I tried to sort of hold it off as long as I can, because chemotherapy treatment is very harsh to the body, and it sort of does knock you about a bit. But at the same time, I didn't go through the same psychological upsets as I did in when I was first diagnosed. So I've always been positive about the treatment. I knew exactly what treatment we're having and everything. So it became apparent that I needed to have some treatment. So I had treatment started in May 2013 last year, and then I had a course of Velcade, which was about 12 weeks course, and I didn't actually get a very good response to that, but I did get a lot of side effects, and one of the worst ones that still with me is that I got this tingling in my feet, which is the endonerve neuropathy, where the end nerves are damaged, and in the cold weather my feet do sting. It's the nerves are telling my brain that my feet are cold, whereas they're actually at a reasonable temperature, and they're okay, and the circulation's there, but it's just the nerves, how they play up.
Do you have any other side effects that people should know about?
Also, as the part of when I was on Velcade, I became sensitive to sunlight. I did, and also it just come out in a rash. I didn't have to be actually in the sun, but I just, even it was just shining through the window, I'd come out in a rash. And then because when you're on chemotherapy, your immune system is quite low. They give you lots of antibiotics and things like that for various things, and then slowly they actually dropped off the various antibiotics, which actually could affect me. So then, after being on this Velcade for 12 weeks, and I had more on the side effects I was getting, they decided to stop the Velcade because it wasn't actually sort of the response wasn't to what I was expected. So I had a little break, then I went on to thalidomide-based chemotherapy, and then within about 10 days of that, I developed blood clots in my left leg. So then I had to stop that as well. So the consultant decided that everything was going against me. So decided that they needed to still go ahead with a stem cell transplant, but I had to have about 2 months break. Says we need to get you better and in good health for the stem cell transplant. And so I was okay with that. And then I was actually quite poorly with the chemotherapy, but as the chemotherapy was coming out of my system, I was feeling better and more healthier and everything. So when I actually went for my stem cell transplant, I was the healthiest I've ever been for about prior to the original chemotherapy.
What is your experience of a stem cell transplant, given you've been through it twice? I'm thinking of viewers who might be facing it themselves. How difficult is it to go through that? It's quite
a big phase treatment to go through both times, but this time it was a bit easier to cope with. And what they actually do, the procedure for the stem cell transplant, is that they have to sort of give you a full, do lots of checks to make sure that you can actually you're healthy enough, fit enough. And the chemotherapy that give you is melphalan, which is the ones that actually supposed to if you've got any disease left in your body, it's supposed to clear that out. And then followed by 2 days later, they actually infuse the stem cells into you through a Hickman line or through a cannula, which was in my case. And I couldn't get a Hickman line in my case, so I had to have a cannula. It took about 2.5 hours to actually get the stem cells back into my, it was 2 bags, and about 2.5 hours or so. Does it just look like a transfusion bag or something special? It just looks like a transfusion blood bag, just red, you know. And then I couldn't see the cells or going in, but they know that if the 2 bags they had that went into your body, they'll get there somewhere. They'll work their way into your hips and the bone marrow and things like that. And do they give you any advice about what you have to be cautious about afterwards? Yes, I was actually kept in for, usually when you actually go for a stem cell transplant, you go into a ward then after a few days, because you become, all your counts and everything is gone low, and it takes about a week for your counts to sort of drop down. Then they stay dormant for about 2 weeks, then they start rising on the 3rd week. And so they put you into a side room, so you're on your own. And I was very, very poorly, and most of the time I was actually had diarrhea, you know, so and then you're on various drips, so regularly you go into the toilet, pass water, and you very rarely get any sleep, and you're just exhausted, but you are going back and forwards. One thing that I found that this time round was that to compare to last time when I actually had a stem cell transplant, I was actually also sick a lot. So any food that I actually ate or brought up. But as things have I see a remarkable improvement. I was given anti-sickness tablets, and I wasn't actually sick, as in bringing food up, and And the food, the quality of the food was actually also very, very good. And I think they overfed you at times, they did. And I felt really weak, and it was expected that you're going to feel weak. And then slowly, as your cell counts recover, you get stronger. But
how long overall until you really start to feel more like your normal self after that stem cell transplant?
I would say now, it was actually early December, which actually had stem cells transplant.
Okay, now it's
only
March.
now, more or less now, March time, that I'm actually feeling
more like your normal self.
More like normal self.
3 months or so.
Yeah, and prior, how I used to feel before the transplant.
Where do you see yourself going from now, given you've come this far already?
I've just turned 60, so I've had a good long working career, and all I would like to do is try and enjoy life, or what else is left of it, because there is no cure for this myeloma, so it could actually come back again, and we don't know when, or matter of time. So I'd like to be able to just enjoy life a little bit, and then just relax, and also visit some countries in Europe, like Greece, where it's hot climate. So possibly I can get relief from my feet in a hot place.
And is there anything finally that you've come across locally that you'd recommend for other centres?
I would recommend that you try to find out a support group, and talking to each other with a similar disease is also okay, but sometimes a psychological support group helps as well, which could offer very benefit. So you need to sort of seek that out.
Because you've had 2 support groups, haven't you? Mm-hmm. You've had the disease-specific one, where there's all other people with myeloma there. But you've also had our psychological one, which is based around how you cope emotionally. And I guess they're 2 different sides of the coin in a way. Both can be beneficial in their own ways.
That's right, yeah. I found that when you actually sort of get diagnosed, you need the psychological support from day one. And which is not available, but it should be available. And the consultant diagnose you with cancer should actually make a referral and give you a choice to be able to go to a psychological support group, because in the early days that's what's important.
Well, that's a recommendation we can take on board, and perhaps clinicians watching this can also take that on board. But it's wonderful hearing your account. It's been quite in depth for you since 2006. We're in 2014 now.
Yes, that's right.
So it's a long journey, isn't it?
It is a long journey, and considering I was only given 2 to 3 years, so anything more than that has been a bonus to me.
Definitely.
And anything beyond this, after this treatment I've had, will also be a bonus. So, and I'll always be looking to share my experiences with everybody and anybody, and because myeloma is a disease that's sort of difficult to diagnose, and I may somewhere along the line, by sharing my experiences and everything, I may help someone to get diagnosed earlier than what I did.
Absolutely. Yeah. Thanks for coming in today.
That's okay, fine.
All the best.
Thank you.